My research is about Parkinson's disease and how it impacts the behavior of people who are affected by the disease. Parkinson's disease is caused by a lack of dopamine in the body and the brain. And this lack of dopamine leads to movements becoming different, becoming slower, or a tremor appearing. But at the same time, a lack of dopamine can also impact our behavior, because dopamine is the neurotransmitter that makes us curious, that makes us want to do stuff, enjoy stuff. So if we have a lack of that, it's clear that that would lead to some behavioral changes. So in the beginning of the disease, often people become less driven or less motivated. Sometimes they say they have a burnout. And then when we start medication, they often become more driven again or more interested in doing things. But sometimes if there's too much medication, this can also lead to people becoming addicted to certain behaviors or things. So my research concerns exactly that. What happens when we give people with Parkinson's disease medication? And then also specifically for people with advanced Parkinson's disease, what happens when we give them deep brain stimulation, which stimulates certain areas of their brains with electrical current to improve motor symptoms? What happens to behavior then? So I do different experiments with patients. For example, in one experiment, I give them monetary rewards for a certain task, and I see how sensitive they are to those type of rewards. Or I see how they perceive emotions in pictures and see what their eye movements do, how they explore things, how their emotions are processed. And I also ask them a lot of questions, of course, about their daily life, what they like to do, how their mood is, how their behavior is, and then also do different cognitive tasks.